So we are in neuro or neurological diseases. Okay, we are studying. Okay, so basically we completed facial palsy or Bell's palsy, trigeminal neuralgia, and epilepsy. Today we are discussing very important clinical and most importantly, very important condition that most of the persons are suffering in this era. Okay, that is CVA. What is CVA? Okay, and we will discuss what is CVA and what are the types and causes, symptoms, and clinical signs, diagnosis, and treatment at last. So we'll discuss both modern medicine and our EH because initially whoever had any type of stroke or any type of CVA or neurological diseases, initially because of the emergency condition, he or she will go to the neurological doctor or neurophysician or neurosurgeon. So they will consult the doctor and they will took the treatment. Then afterwards, if the symptoms subsided or they will feel well, then they will continue their own then there itself. But if the symptoms are not cured or the patient doesn't have satisfaction, so they will go to the other doctors. Okay. So that's the reason we have to know the medical field knowledge also. So I will explain here. So basically, what is CVA? So I have one slide, simple slide. You can understood here. CVA. CVA stands for cerebrovascular accident. Means cerebro means in the brain. Okay. Cerebro or brain. Vascular means vessels. Accident means you know that accident means it is the crushing of any substance or object or any area. Okay. If it is come to the brain, brain vessels are damaged. Okay. The brain vessels are damaged. Why the brain vessels damaged? So here you have the types. So basically, most of the CVA are two types only. Okay. Initially, in the 900 cases, you will get 99% cases are from this two. Okay. Either one is blocked. Okay. Block vessels. Another is ruptured vessel. Okay. So what terminology you are giving? You are giving if there is any clot in the blood vessel, we will call ischemic CVA or ischemic stroke. If any rupture in the blood vessels, we will call hemorrhagic stroke. And the most common is ischemic stroke. Okay. So what does CVA mean? CVA means it is the damage of blood vessels within the brain. Okay. What? How many types are there? There are two types: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the blockage of, you can see that this image. Okay, here we have this is the brain. Here you have ischemic stroke and you have the hemorrhagic stroke. Okay, in the hemorrhage, there is a small rupture of blood vessels and blood is coming out of the vessels. Like you are having any pipe, okay, you are filling any bucket with the pipe. Suddenly, what happens? uh, there is there is a in the pipe area there is a small hole. Okay, because that area is uh, very simple, and it cannot tolerate large amount of pressure, so it ruptures. Okay, what happened? The small amount of water will come rapidly, very fast. Okay, because of the ruptured area, but the whole pipe is not damaged. Whole pipe is having the uh, source of water, and you are filling the bucket, but small amount is ruptured. So at that area, the water is pressurely coming outside. Okay, yeah, this is the hemorrhagic stroke. An ischemic stroke is that suddenly, if you are uh, filling the bucket with the pipe, so what happened? From that water itself, they have any stone. Okay, there is a stone which is very large, larger than the size of the pump or size of the pipe. What will happen? It will stuck. It will stuck, and the pressure of water cannot be passed through that stone. So, so you cannot fill the bucket. Okay, what will happen after the pressure increases? Sometimes the stone will pass away if there is a small amount of stone. Okay, if the amount of stone is large, what will happen? You cannot the water cannot pass from the pipe. So that is ischemic stroke. If the small stone is that, so sometimes for a few minutes to few seconds, the water is stopped. Then again, the stone starts melting because of the pressure. Okay, so the stone passes away. So we will call this is transient ischemic stroke. Transient ischemic stroke. Here you can notice that the TIA, transient is ischemic stroke, interruption of blood flow in the brain. This is what we call mini stroke also. Sometimes doctors, he or she got mini stroke. Suddenly, she fell down, or someone fell down and unable to walk with for 5 to 10 minutes. Again, she become or he become normal. So what we will call mini stroke. So you can see that this is the brain. We have lobes, frontal lobe, parietal lobe, temporal lobe, occipital lobe. This is cerebellum. Okay, where the part of the brain is affected, you will get that symptoms. Okay, that's symptoms. This is very important. So here you have the brain, which control right side and left side of the body. Right side controls left side of the body. Left side control the right side of the body. So here we have the left brain. What are the function of left side of the brain? If the ischemic stroke or hemorrhagic stroke occurs, what sign you will get? Okay, patient have before going to the patient, normal function, logic. Okay, you can have logical sense from left side. You can solve the problems. You have difficult tasks. You can solve with this left side of the brain, and words. Okay, languages. If you want to learn languages, you need left side of the brain. Okay, detail oriented examination or anything, like you want to buy the phone. What you will do? You will search everything. If you want to buy the clothes, you will touch the clothes and ask the fiber quality and price, everything. So whatever thing you are using for yourself or for anyone or for any purpose, so you will go in detail. So this is left side of the brain, and safe, and everything, whatever left side was saying, that is in the safe mode. Okay, because it have very logical thinking. And right side for feeling. Okay, any emotion, feeling, cry, angry, feel, everything. Spatial perception, and whatever we will have perception about things or anything. Okay, so we will have from right side of the brain. Risk taking, left side is very logical thinker, and right side is very it will take risk. So it is very important. So whatever patient is unable to do, so you can idea, or by the examination you have idea that this patient having this problem, this side of the brain is affected. So we will go in detail. We will have 3 to 2 times we have to repeat to understand the whole CVA, because it is very detailed oriented subject or class. Okay, so first we will understand with this slide, then again we will go to this with this my book, and again we will understand with some other texts. Okay, what are the some effects of left hemisphere? So left hemisphere, what it will do? Right side neglect, apraxia, difficulty with max, act slowly, cautious. So what happened? Left side problems occurs, so you cannot able to lift the hand. If it is depend upon the effect. Okay, if you're lifting the head with really slow with low power, it means that right side is affected, left side is affected. Okay, right hand you're not able to move right. Difficulty in max, you are unable to calculation. If you ask the patient time about dinner, like there's some simple logic questions. Okay, he or she cannot be answered. Okay, then act slowly, like this sound will come. Okay, and they have very cautious. Okay, if right side is affected, what will happen? Left side will neglect multiple. Difficulty in swallowing is there, very important. This is if the patient comes to you with difficulty in swallowing with the history of CVA, means right side affected without showing the MRI CT. You can, with the examination only, you will get that. Okay, and short attention and impulsive, denies defects, or some defects are there other than that. And what some effects of cerebella? If the brain is affected, what will happen? Backside of the brain, cerebellum. Okay, dysarthria, patient having difficulty in speech or slurred speech. He have not complete words, like I am dysarthria. I said like that, unable to spell the words clearly. Ataxia, no balancing is there, not difficulty in balancing, unable to uh, like if you tell them that this is the examination, straighten the hands, one hand will go down. Okay, and balance defects while walking, unable to walk, they need support. Okay, so here we have in this. Okay, so this is the basics you have to understood. Again, we'll come to the uh, other things. So this is the CVA types, and what are the examination, what are the symptoms you can understood, you can relate to the brain. Okay, so this hemorrhage will occurs any part of the brain. Okay, let's see that we have how many types of hemorrhage. First we will discuss about CVA, hemorrhagic stroke. Hemorrhagic stroke. Hemorrhagic stroke is one is capsular, and another is cortical, and is thalamic, and midbrain. Okay, and is pontine, and medulla oblongata, and ventricular hemorrhage. Okay, so let's see the image first. You can understand easily. First is capsular. You can see this the capsular hemorrhage within the brain. Okay, what will happen in this? In this, the bleeds down from external to internal. It is not happening in the vessels. Vessels are not leakaging that blood. It is coming from outside to inside. Okay, this is very important. In this condition, what are the common features? You can see that symptoms in the capsular. With these symptoms only, if the patient are coming with these symptoms, they can easily understood that this patient belong to capsular hemorrhage. Then, how much amount is affected? You need by this scan, MRI or CT scan. It is very important. First is uh, external to internal. Okay, this is the first thing you have to understand. And the second thing is that patient becomes unconscious. So whenever you are giving on examination, consciousness is unconscious. Patient is unconscious. Very important. Okay, and the there is a rapid breathing. Rapid breathing is very important. You have to see that. Okay, and deviation of pace also seen sometimes, or the reflexes will lose. The urination control of urination will lose. Patient have stool. They will pass the stool. Okay, and increase blood pressure. Reflexes will lose, like urine and stool can be passed. Okay, and the temperature will increase. They will have fever also. So if the if the hemorrhage will not stop continuously, the hemorrhage will increase. It will enter into ventricles also. Okay, ventricles also. So these are the capsular hemorrhage and their related symptoms you have to observe. Next is after capsular hemorrhage. Next we have cortical hemorrhage. So you can see that this is the hemorrhage part. So this is the mostly you can see this is the cerebellar hemisphere and this is the pontine bleeding. Okay, so there is nothing different, but there is an area which part is affected. Okay, thalamic thalamic hemorrhage means in the area of thalamus the bleed happened. Pontine, you can see this is the pontine area. Pons, we have midbrain. Okay, we have pons, medulla oblongata. Okay, if the bleed happens in medulla oblongata, then it will call medullary hemorrhage. If the hemorrhage occurs in midbrain, we will call midbrain hemorrhage. If the hemorrhage occurs in pontine, we will call pontine. In fact, if the hemorrhage occurs in ventricle are nothing but they are the CSF fluid continuously flow in that area. So if the hemorrhage occurs there, so we'll call ventricular hemorrhage. Okay. So these are the things we have to remember. So we'll go to the straight to the symptoms. So we talked about capsular hemorrhage. Now we'll come cortical hemorrhage. Okay. In that cortical hemorrhage, the patient will is conscious sometimes. First thing is that, and after the convulsions may take place. So patient have fits or convulsions. Okay. Paralysis may appear to one or more extremities. Means left or right hemiparesis or hemiplegia. What is the difference between hemiparesis and hemiplegia? Anyone can tell the answer? Aphasia. So we will divide in two parts this class. Okay. Aphasia. Okay. So can anyone tell what is the difference between hemiparesis, hemiplegia? Hmm?
Hemiplegia, their blood will came out in brain area.
Hmm. Hemiparesis?
Hemiplegia is their blood clot.
No, no. Hemiplegia, hemiparesis, these are symptoms, na? Already we talked about cortical hemorrhage. So it is hemorrhage, hemorrhagic stroke only. Confirmed. Corticals is the front part of the brain. There is a conscious patient will conscious have convulsions, hemiparesis or hemiplegia, aphasia. If right side occurs, right side occurs aphasia, left side occurs swallowing difficulty. Okay, these are the things will happen. But what is hemiparesis, hemiplegia? Hemiparesis means there is slightly weakness in the limbs. Slight weakness. Patient is unable to lift the hand, but there is no power. Unable to walk. Patient able to lift the leg, but unable to walk. Okay, they have power. Okay, power is there. Power is there. Plus. In the hemiplegia, there is no power or unable to lift the hand. Nothing. Unable to unable to lift the leg. So hemiplegia will take time to recover, but hemiparesis will improve within the 1 month, within the 15 to 25 days or 40 days, within the 2 to 3 months. Hemiplegia will take time to recover. This is because this is the complete damage of the nerve in the brain. Okay, so this is occurs in cortical hemorrhage. So this is the thing you have to understand. If a patient comes with the limb weakness, right side, left side, any part, it means that cortical brain is affected. This is the thing you have to remember. Next is thalamic hemorrhage. Okay. In the thalamic hemorrhage, it is thalamus is a gland in the brain. So the hemorrhage occurs around the thalamic area. There's the reason we will call thalamic hemorrhage. Here, the patient have very severe pain, very severe pain. This is the thing you have to remember. In the other hemorrhages, there is no pain, but pain will depend in the brain. But here, pain may be in the whole body or in the brain also, in the head also. Okay, and patient have weakness also. Okay, weakness of any side, right side or left side, and loss of posture also. Unable to see if a patient able to sit, like it will come forward. If you again you will do that, he will come forward. If you put him right side, he will come left side. If you put him right side, he will come left side. So loss of posture will there. Okay, and after that, loss of posture. So these are the these three things are seen other than those symptoms. Okay, next, after thalamic hemorrhagic stroke, we have midbrain hemorrhagic stroke. Okay, what will happen here? The patient have paralysis Paralysis means hemiparalysis, hemiplegia. Okay. And most of the midbrain hemorrhagics unconscious mostly, and they have respiratory rate issues and having heart rate issues, BP will arise, and severe headache, occipital side. Okay. So these are the symptoms. You can see midbrain hemorrhagic stroke in the pontine also, very important pontine hemorrhage. Most of the person who have midbrain, pontine, cerebrum, cerebellum, medulla oblongata, so they have very high risk. They will most than 80 to 90% are less chances to alive because they are the most dangerous parts, or they are even because this is very sensitive parts. Okay, even if the hemorrhage become very large, so even though if you operate the patient, there is less than 5% are chances. We'll see the percentage of patients. Okay, after this pontine, midbrain, and medullary. So in that, they are the same symptoms like respiratory issues. The patient will go undergo to the ventilation also, ventilation, unable to take the oxygen, unable to release the carbon dioxide. So they will forcefully insert the pipe in the lungs, and with the support of ventilator, the patient will take the oxygen and release the carbon dioxide. Okay. Sometimes the patient will die out. So these are very dangerous hemorrhage. Ventricular hemorrhage also death. Most of the person will die because they are a very sensitive issue, very sensitive area. Okay. So these are the hemorrhagic areas. Next is cerebellar. We have cerebellar hemorrhage, cerebellar hemorrhage. In that, what will happen? The patient have vertigo because depending upon the area, cerebrum, okay, or sorry, cerebellum. The cerebellum, these are the parts of the here. We have very sensitive part. Most of the persons will tell, don't hit anyone here. Okay. So here you have the cerebellum because it is related to position. Okay. Position. So you have vertigo and vomiting sensation. Patient have vomiting, unable to swallow the food. Okay. And the patient having very, because this is occipital area, the patient having very different uh, uh, vision is affected. Okay. And the patient have fever, very high fever, and speech and swallow affected. So if these symptoms, we can see that in the patient, you will go to that this is the cerebellar, okay, cerebellar hemorrhage. Other than we have uh, those hemorrhages which are not in the brain, outside the brain, outside on the skull area. Okay, you can see that we will call SAH, subarachnoid hemorrhage. In the within the layer of the brain, you can say this is the, we have subarachnoid, sub SDH, subdural hemorrhage. Okay, subdural hemorrhage. You can see that this is the skull. This is the uh, arachnoid space. This is the subarachnoid hemorrhage. You can see that this is not in the brain, outside the brain. It is due to the accidents, due to the damage, due to the uh, due to the any trauma, due to the uh, fell from the bike or any accidents which sudden the skull will touch to the hard substance, then the bleeding will happen. So you have subarachnoid hemorrhage, sub dural hemorrhage. Okay. So these are also very dangerous. Sometimes by doing operation, it will become okay. Okay. So this is all about the types of hemorrhages we discussed. So tomorrow we'll discuss other than symptoms, causes, and other things. Okay. So here we are going to stop the class.